Dry eye or dry eye disease is a condition where the eyes does not produce enough tears or the tears are of poor quality, leading to inadequate lubrication and moisture on the eye surface. This can cause various uncomfortable symptoms and in some cases, vision problems. Research suggests that the global prevalence of dry eye disease is estimated at 11.59%. Dry eye involves disruption in the tear film, which is a complex layer of 3 parts, the mucus, aqueous, and lipid, that coats and protects the eye. Today on your favorite health TV talk show, The Physicians, we have an expert in the house that will be talking about dry eye, the causes, the signs and symptoms, the risk factors, and of course, the management. We'll be right back after this time out. Do stay tuned. It's another day on your favorite health TV talk show, The Physicians, where your health is our business. My name is Dr. Memuna Yusuf Kadri, and of course, I'm not always alone in this program. I have my amazing and beautiful co-anchor, and she's no other person than...
My name is Dr. Martina Agbere. Welcome to The Physicians, where your health is our business.
And will always be our business. We're talking about dry eye. You're doing dry eye.
When you got to the point and you said poor quality tears.
Now so,
I said,
now it's you.
Memuna, poor quality tears. Which one is the poor quality and
good quality tears?
Is it the poor one
or the good one? And let us know what it is.
Oh,
so I think my encounter with dry eyes has been more with the elderly. I've had some cases where that was an issue, two cases precise, and in recent times. And because they had other comorbidities, one had hypertension and diabetes, the other one had, I've forgotten the illness here, but those were the reasons, you know, while they were managing that, these other manifestations also came. I'm like, wow, you know, we just move around and you just think, okay, our eyes are our eyes, right. Forgetting that, not knowing that something is lubricating it. That is why we are not having that, the pain and the itching or the feel that your eyes, something is wrong with it.
Okay, so my first encounter was when a patient came with the complaints of always itching and pain, okay? And I had to refer to the eye clinic. And the diagnosis was that they said dry eyes. And the guy was asking what
exactly
eyes?
So
what is supposed to be happening to my eyes and everything. They sort of explained, and they had to place him on some eye drops.
Yeah.
Then some exercises that he needed to be doing, and they gave him this sheet, the kind of exercise that he should be doing. So that was when I say, so there's something like dry
eye. It's surprising, truly. There's always a condition, you know, and it's because a lot of things we take for granted, like the air we're breathing. We won't know the cost of oxygen until you get there and know that, wow, this air it has been free. You know, so so you just know how some people took like 20 cylinders, 30 cylinders just to stay alive. Just the way we are moving around and we don't know that, you know, these are eyes that we are all feeling everything is fine. Some people, they find it even difficult to have this free movement and free good eyesight just because we have taken it for granted. But it's good.
It tells you that every part of the human
it's important.
Is very important.
Yeah.
They all have their roles. Everything has
yeah. Nothing. Yeah. We have an expert in the studio who is going to tell us about dry eye, the causes, the signs and symptoms, of course, the management and prevention, because dry eye is real. And in some people, that is their reality. We'll be right back after this time out. Do stay tuned.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite. Love yourself.
Welcome back. If you are just joining us, this is your favorite health TV talk show, The Physicians, where your health is our business. With us today in the studio is a damsel. She's no other person than Dr. Funmi Ekorowiro. I'm not bastardizing it, I'm Edo, she's Edo, but I think that she will tell us the better pronunciation when she comes on board. She's a senior medical officer at IBEJU-LEKKI General Hospital. Dr. Funmi, you're welcome.
Thank you for the opportunity to be here today.
Welcome to our program.
We are talking about dry eye. And this one, you're wearing goggles like this. It's good for our audience to know that there's something like dry eye.
Exactly.
And how do they even know what dry eye is even all about? Because it sounds like, is it witchcraft? Or is it even a medical condition? But please relate it to our audience and our participants.
Thank you for the opportunity. I'm super excited to actually talk about this dry eye disease because it's often neglected and it is very common.
Wow.
Within the society, because about millions of people have actually been suffering from this dry eye. And then if you are going to talk about dry eye, it doesn't necessarily mean the eye is dry, fine, but some other people actually complain of other things apart from their eye being dry. So when we are talking about dry eye disease, it's actually as a result of either the tears that are being produced has been reduced, or there is rapid evaporation of tears, making the eye uncomfortable to actually stay in. So that is what I can actually say concerning the introduction about dry eye.
What is the function of the tears?
Oh, that is, I love that question. Actually, tears are essential components of the eye. It washes away the debris, it moistens the eye, and then it also protects the eye from any form of infection.
Okay, so those are the functions of the tears, right?
Yes.
So do we use it positively or negatively? Because when you are going through an emotional stage, right?
Yes.
Somehow the tears just come. Okay.
And sometimes the tears don't even come.
Yes.
You are so overwhelmed, you just want to cry, but the tears,
are not coming.
And when you consider the number of, the amount of tears that come, depending on how long you are shedding the tears, how is it possible that you still have enough tears to lubricate the eyes? Does it come to a stage where you don't even have tears again?
Yeah.
Okay, thank you for the question. Actually, when this emotion sets in, it sends message to the brain. Then there is something that is around the eye, which we call lacrimal gland.
Okay.
This actually produces the tears that makes the eye to actually get moistened. So that is where the tears is actually coming from. But when you are not producing enough tears, I think that is the point where you need to actually move to the ophthalmologist to actually check your eyes.
So maybe there's a problem with the lacrimal gland.
Exactly.
Is possible?
Exactly.
Because unable to
possible.
sense, they can't send signals to the brain.
And that's why we come to the next question. What causes dry eye?
Okay, there are a lot of things that causes dry eye. For dry eye to actually occur, it starts from instability in the tear film. And when we talk about tear film is a multi-layered film of the eye. It covers the surface of the ocular area. So when there is a disruption in this layer, it leads to dry eye. This tear film has different layers and they have their own function. So when there is a disruption in the layer and as well resulting in any dysfunction of the gland, it leads to dry eye. There are other factors that can cause dry eye. Talking about the environmental factors, that is exposing the eye to dust, exposing it to dry wind, direct vents from the car towards the eyes, or overhead fans. Use of overhead fans, yes, can actually cause dry eye. So sometimes I discourage the patient from using overhead fans because of the dust that are attached to the fan. And then apart from that, we also talk about the lifestyle. The lifestyle of an individual can actually pose someone to dry eye. First of all, contact lens wearers. Yes, continuous use of this wear off the tear film, yes, and can lead to dry eye. And apart from that, prolonged exposure to screen. Though I understand that there are some people that cannot do without use of a computer and all.
Maybe that's like social media.
Like social media and all. But there are other things that we do for them when they get to the clinic, and there are other things that we still discuss that they can actually do to prevent dry eye.
Exactly.
And apart from the lifestyle, we can also go on to the medical condition. There are some medical conditions that are also associated with dry eye. For example, diabetes mellitus, rheumatoid arthritis, Sjogren's disease, even some eye conditions, what we call ectropium or entropium. That is when there is inversion of the lid or eversion of the lids. And there are other conditions and so on, pterygium, Bell's palsy, that can cause dry eye. And apart from that as well, let's talk about the diet.
Very important.
Very important.
In this environment where everybody is struggling to meet up with,
Exactly.
Eating morning, afternoon, night, and eating to fill up the tummy.
Exactly. Not if we are not eating food containing vitamin A, that is vitamin A deficiency, or omega-3 deficiency, this can also lead to dry eye.
How do you know? So, two prone approaches. How do you know the signs to watch out for dry eye? Because we know it's a disease, but what are those signs and symptoms we should look out for?
What they present with.
Yes, how do they present? Some people won't just think, I have dry eye, let me just be pouring water. Maybe that's the reason. If I pour water, it will be okay. And how do you manage it?
Okay, thank you for that question. Most of the symptoms that the patient actually present with, they present with one, grit or sand sensation in the eye.
That's why they always rub
They always rub the eye. And excessive or continuous rubbing of the eye can lead to another thing. That is corneal scarring or ulceration. Then the next one that they present with is increased sensitivity to light.
Okay.
Then another one is redness.
Of the eye.
Yes, of the eye. Then the one that most of the patient actually present with is tearing, excessive tearing.
Excuse me.
Water will just be
Yes, water will just be dropping
Nobody
from the
has
eye.
eaten you,
Nothing.
And
Just be
you
dropping
are talking
from
about
the
dry
eye.
eye.
I'm talking about dry
Yeah,
eye.
yes,
dry eye and excessive tearing. Oh, wow.
Okay, this is how it happens.
Does that excessive tearing now cause the dry eye?
It's one of the symptoms of the dry eye.
So what's the
Are you serious?
Okay, so when when the eye senses,
and tears are wasting tears. I don't understand.
so when the eye senses there is a foreign body, that is the gritty sensation or the sandy
Okay, so
sensation,
it has to
it sends
produce.
message to the brain.
Okay.
Okay, lacrimal glands start producing water to wash up the debris. So that is what actually happens. So it's one.
It's almost like when you have an autoimmune disease.
Exactly.
The body begins to react to it.
Readjust to it. Yes. So those are some of the symptoms of the dry eye. So the eye becomes discomforting. The eye will red, and again the grit and sandy sensation to the eye. Then excessive tearing. So mostly those are the symptoms that they present to the hospital.
Okay, so is there any room for genetics here?
Yeah.
Okay, I won't say it is from genetic.
Because from all the causes that you have enumerated, some of them are just man-made too.
Man-made, yes.
And especially the one that has to do with lifestyle.
Exactly.
I can imagine the number of people, the patients that will be coming down with dry eye as a use of the devices.
Yeah.
Yes.
I
a
worry
lot.
more for children.
Yes.
I worry more for children now because some parents actually do like a palliative for the children. All they want to just do is use this device,
so that they can-
let the child
yes.
not cry. Then they put on the screen and just put the seat there, keep watching this particular cartoon. So they spend a whole lot of time, yes, on the system. So that said, is there a permanent cure?
I would say dry eye is treatable.
Awesome.
It's manageable. If one presents early to the hospital. Because presenting late would have caused a lot of damage to the eye. So immediately you are noticing these symptoms, I will advise you come early to the hospital. Yes.
So no permanent cure, it's just treatable.
It's treatable,
and
palliative.
So what are the tests too? Because you made mention of Schimmer's test and the other one. What are those specific tests that you can say, okay, this is what tells about the dry eye, and if there are medication or
The volume of
medication,
tears to produce.
Okay, all right. We've talked about the Shima's test, we talked about the rod red thread test, and as well when they come to the hospital, we do what we call a slit lamp examination, where we stain the eye to check the eyelid, check the conjunctiva, check the cornea for any ulceration or any scarring. Okay. So that we are trying to rule out other things that can cause it. And as well, we also, if it sense there's any systemic condition causing the dry eye, we send them for the test to do.
So for the elderly people in our community, do you think that dry eye is also synonymous with them? Like as they are aging gracefully, the number of tears, the function of the lacrimal gland is reduced?
Yes.
Okay.
Yes. Most especially still the women.
Because of the menopause? Because of menopause? Right?
Yes, because of menopause. Yes. Yeah. So they often come.
So what are the first aid kind of treatment for dry eye? So, because if they come to the hospital, you treat them, but letting them go back to their house, what do they need to be doing to help them, to ease off the pressure?
All right, thank you. I will start with those that are on medication. I will advise them, please do not stop your medication. Come to the clinic, let them know, and then they will know how to refer to the ophthalmologist. For house remedy, we can actually do what we call warm compress to dab the eye. And as well, I also advise them to use a non-irritant wipe to clean any, not scented, no alcohol base, no preservative, to clean the eyelid. So after that, and for those that are always on the system, so we advise them to do what we call Rule 20-20-20. So when we are talking about that, we'll tell them to take away your eyes from the screen for 20 minutes, blink, then look at an object that is 20 feet far from you for 20 seconds. Then you return back to the system.
So Rule
20-20-20, yes.
So especially those that have to work with the computer.
Exactly.
Always. So how do we prevent dry eye?
So for us to prevent this dry eye, number one, we'll try as much as possible to get rehydrated more often. Then I also advise on use of humidifier in the house.
It helps?
It helps. It helps. Then
so it's not just for the aesthetics?
It's not just for it. It's not. So, and as well, I will also advise that we should not use direct vent when we are in the car because of the AC. Don't direct it towards your eyes. The dirt comes out. Exactly. And as well, I also talked about the use of overhead fan because of the dust that are attached to it and all. So those are the ways that we can actually prevent it.
Okay, I know we don't always talk about the care for the eyes, right? Yes. Nutrition-wise, vitamin A, retinol, and other stuff. Is there any room for nutrition, the kind of diet that you take? And are there any for dry eye that will help prevent it? And are there any like medication supplements that are probably that contain the omegas that is recommended? Okay.
Let's start with nutrition. For that, I will encourage us to take fruits. Then as well, fruits that are high in vitamin A, vitamin C, that are high in vitamins, and as well food that contains omega-3 to avoid omega-3 deficiency in the body because that can also lead to dry eye. So for the supplements, sometimes what I recommend is eye antioxidants for my patients. That can also help them and also boost their vision. Okay. So anything, there is room for that. But in case they start feeling those symptoms or start having those symptoms, they should please present back to the hospital.
Okay, so from what you have just said in summary, you talked about the lifestyle, you talked about the medical conditions, right?
Yeah.
So is it okay to say that children won't present with dry eyes?
Though it is more common in elderly, but it can also occur in children.
As young as?
I've even seen what's it called, a 1-year-old child that was brought to the hospital for tearing because the mom is always putting on screen.
You see this great trouble now.
So because there are blue rays of light that has been emitted, and those things are dangerous to the eyes.
That's how we find it difficult to sleep.
Yes.
At 1 year old.
And when you don't sleep, you won't be able to blink the eye. Tears will not be produced. It will make the eyeballs like to be dry.
Imagine the pain that. So children can also
experience it.
Experience dry eye
Yes.
as young as 1 year.
Yes.
So what advice do you have for parents? Because I need you to speak to parents right now. What should they do to make sure that, because damage at 1 year old is almost as if it's a damage for life. Though it is manageable, it is not curable.
Okay.
Yeah.
You're going to speak to parents for
Yeah.
children, right? And to adults.
Yeah. What they need to
Because
do.
we spend a lot of time on our system. So, and you already talked about the 2020 rule.
Yeah.
You've already addressed the adults. So for these children, with parents, because when maybe they cry, they do. Even in church, you see them giving the anywhere they
Anywhere,
are.
yes.
Anywhere, yes.
Yes.
And I think they see it as a status thing. I don't know.
Nobody is tired.
Yeah.
Talk to the parents, please.
So for her parent, I will advise. Though I understand that you might want to take the child off because the child is disturbing, but at least anything more than 20 minutes on the system, please take the screen away from the child because you are causing more harm than good for the child. And as well for the elderly that are always on system, like I said, Rule 20-20-20 will also help. And for those that are also on system, try as much as possible to blink often. When you blink, it produces more tears to wash off any debris and prevents dry eye.
So there's a screen now that they buy. Is that for aesthetics that you say put it on your screen to
prevent
yes, like a blue anti-blue ray lens. Yes,
is that
yes.
something that is also good?
Yes, it is also good because when they come to the hospital and they start complaining of those symptoms and as well eye strain, maybe they're having headache and they're having problem with their vision, we prescribe what we call anti-blue ray lens to actually shield off the blue rays that are being emitted from the screen.
And so sleep is also very important.
Sleep is essential.
Nimona, you just heard.
Sleep is important. You know, the thing is that we always don't have so much time on this program. But what you have just said now, I know a lot of parents will have, you know, great takeaways from, you know, letting them know that this screen thing is not longer a joke.
Exactly.
If you can see a 1-year-old with dry eye disease, then that means anyone
That is
can
really
have,
scary.
Yeah, it's scary. And you would just think, like you said, it's a fancy thing. Let me just feed the child on the screen for the visuals. After all, I have the phone, I have the tablet. So what's the big deal? But there's a big deal, right?
I'm glad the parent actually brought the child because some boys say, "Why are you always crying? Meanwhile, the child is not crying."
Exactly.
And
You have started again. This your cry is coming again. You know, for no reason.
Thank you so much, Dr. Funmi. I hope when next we call you, will be right here to educate us more on very important, pertinent things when it comes to our eyes and everything surrounding our eyes.
Of course.
Last question. Why is it that ophthalmologists always wear glasses?
Do you have to answer that question?
Everybody has their own refractive error. So when you get there and get your eye examined, you will know that, oh, there's actually one eye that is actually compensating for the other.
This is physician need themselves. Now you are aware, you wear your glasses.
Exactly.
So for some of us, they feel that we are due for glasses, but we are trying to
Excuse me.
Anyway.
She uses contact lenses.
I don't use any contact lens, and I can see very well.
Don't worry, age is coming in.
Thank you so much, Dr. Funmi, for this wonderful experience, and we hope to see you next time when we call on you. To our audience, you've heard all the, you know, it's very important for us to know that a lot of things that we take for granted, they are real. So there's a disease called dry eye disease. It's not something, you know, out of the way. Some of us have that sandy feeling and be scratching, itching your eye. You know that this is a real issue. So if you have anybody or you are experiencing it, please reach out to the doctor immediately so that you can get treatment. Dry eye disease can be treated even though it is not curable. And she's mention of the 20-20 rule. 20 eyes on the screen, take time out, look at something that is 20 feet away, and then you come back.
Blink. Yeah.
Blink is very important. As young as 1 year old has gotten dry eye disease. So it's not a respect of any, you know, age, but women are more at risk of having dry eye disease. So women, we have to do more in taking care of ourselves with regards to our nutrition and our lifestyle. Until next time, my name remains Dr. Mimuna Yusuf Kadri.
Thank you, Dr. Funmi, for coming, and we look forward to seeing you again. And to our viewers out there, you already heard everything that she talked about: lifestyle, contact lenses. I'm not saying you shouldn't use a contact lenses, but you should know when to take them out and care for them. Then lack of sleep. A lot of us watch movies, we're always on our tablets. Okay, dry eye is actually calling. And for mothers, please take that time. Bond with these children instead of just keeping them away because they're probably distracting you and you give them a tablet to always use. The way they live now determines how their eyes will be in future. And for patients that have medical conditions, always ensure that you use your medications. And if you have any challenge, just see your doctor. Some side effects. If you have these gritty eyes, you have the rubbing, ensure you go and see your doctor. Then the fan, you talked about the fan also. Be careful how you use them all. My name is Dr. Martina Agberi. Please remember to follow us on our social media platforms. If you want to be part of this program like Dr. Funmi, just give us a call or send a mail to us and you'll be invited here. Till next time, stay blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite. Love yourself.